This week, we've had a mission clinic here at Grace Bible Church in Bozeman, and we've been full all week. Now today, we have a line waiting for people to be seen. There's access to care issues everywhere. It's not just in our rural communities. Montana is one of the top 3 health provider shortage areas in our nation. But, Bozeman's a lot bigger town, and we still have a lot of patients to see. Access to care for dental is overlooked a lot of times. We really focus on whole body health with our program, because if your mouth isn't healthy, the rest of your body isn't healthy. And that even goes into the importance of mental health. If you're suffering on a daily basis and you're in school, you're not going to learn when you're focusing on your pain. We have a lot of kids that are in school sitting there all day with a toothache, and they're not able to concentrate on their studies. So we find that it's really, really important to not just look at how someone's mouth looks and if their teeth, are shiny and they don't have cavities, but there's also really a need for us to be asking how they're feeling other than that. And that even goes into their mental health. So this year we've begun bringing mental health into our oral health clinics.
Nationwide, nearly 50,000 people commit suicide each year. That's 1 every 11 minutes. It became really apparent to me that we needed to implement behavioral health, mental health, and medical dental integration even further into our program at Smiles Across Montana. I'm not saying that we look at ourselves as mental health providers. I'm not saying that at all. I think that the most important thing that any dental or healthcare provider can do is ask their patients how they're doing. We actually engage our whole team in this, hygienists, assistants, and we actually just recently added community healthcare workers to our program. And our community healthcare workers at this time, they're actually being trained on trauma-informed care, on trauma response, and we're really excited what this is going to do and what this will enable us to do at Smiles Across Montana to actually be a part of suicide prevention. We're not asking that you become a mental health provider, but that you ask questions and that you have available resources that you can give your patients if they might be depressed, that you have somewhere that you can send them.
Here we are today with a 4-day free mission clinic to serve the community ahead of the 49th annual MSU powwow. It's something my daughter and I talked about, me volunteering here in Montana. My daughter chose Montana because she loved the West. She loved Native American culture, as do I. I mentioned that I would love to come volunteer my skills as a dentist, and she's like, "Mom, that would be amazing. That would be great. You have to do it. You have to do it." And so, in her memory, I'm committed to being here as many years as I can. Losing my daughter, the pain of that, this has been something I've looked forward to, planned for, fundraised for, tried to get the word out in my community, and it was a wonderful sort of balm to my soul that was hurting, and at a time that felt particularly dark. This mattered to me.
What Smiles Across Montana has been able to do is take these medicines that treat cavities, and through dental hygienists and nurses, bring them out into the community that's suffering the most from cavities, and in their mobile approach, place them on teeth where people are, and they can start healing this most common disease in humans with these things that are very effective, very simple, and very human-centric. Our overall mission is to have people not suffer from oral diseases. The most common disease in humans is cavities. And some folks that have resources and get to go to a dental practice every 6 months, they don't realize that people are suffering. And in a place like Montana, all across the state, people are suffering from cavities in the most rural areas on the reservations. And so what we're trying to do here is bring care to the people. And we don't necessarily need to bring all the complicated stuff. If we have just a little brush, a little piece of cotton, and that's enough to treat a cavity, then we're going to be able to drive out to places we haven't been able to go to before and provide care. We're trying to validate that that is a solid approach, that the American Dental Association put in their guidelines that clinicians should prioritize this type of care. But we do need people's help. We do need the community to tell policymakers their dentists, other decision makers, that they want this type of care, that they will be okay with a nurse putting a little liquid medicine on a tooth, that they want a dental hygienist to come out to the school, to the nursing home, to the reservation, and provide this type of care.
Really about mental and dental integration and how important it is. Our oral health is linked to so many other things in our body. We need to have more of a present conversation with our patients and make sure that they have a good support system. They can talk to somebody if they need to, and how it's all related. And we're here this week serving the Bozeman area in honor of somebody who wanted to reach out to people in need. And we want to just bring a big awareness for mental health and have a conversation with our patients in the dental chair and make sure that it's more talked about.
Acts of service and access to care, it takes a village to get that done. If more people from the community are able to help us, we can continue to serve the people of Bozeman. We're not just providing dental care, we're restoring dignity and easing the pain of our patients. We can't do this alone, whether it's a donation, your time, or just sharing our mission with others. Every individual deserves the chance to smile without hesitation, to feel seen, valued, and cared for. If you want to learn more about what we do, why we do it, and how you can be a part of it, you can reach us at smilesacrossmontana.com.